Well, we know this is the time of year when we really can start to get the winter blues. The holidays may even get us down. But how do we tell the difference between being sad and the blues and true depression? We asked that question today to Dr. Steve Samuels, who joins us live in studio. He's from Franciscan Health. Thank you so much for joining us right now.
Thank you for having me.
This is a real thing. What do you see in your office right now?
Right now we do start to see, some people call it the winter blues. We call it seasonal affective disorder. And it's a very common disorder in people, especially who move to the Midwest from sunnier areas of the country or from sunnier areas in other parts of the world. They don't get enough serotonin in their brain. Serotonin is a chemical that tells us we're good, we're okay. And so during the winter, when you're not getting as much sunshine, the serotonin goes down and you start to feel very depressed. And so there are treatments for that. Serotonin reuptake inhibitors, common ones like Prozac and Celexa, will really help with that and upregulate. You take them during that time of the year, October to March or so.
Okay, what are some alternative options for people that say, you know, I don't feel great, but I really don't want to take medication?
For seasonal affective disorder, UV light therapy is very commonly effective for those people. And so sitting under a UV light for 1 to 2 hours a day can help upregulate that serotonin. What we don't want to see people do is try to self-medicate. Alcohol or illicit drugs, especially alcohol, it is a chemical depressant. Although you may feel good for 2 or 3 hours after drinking the alcohol, it depresses the brain for the next 20 to 22 hours, and so don't try to self-medicate.
That only makes the situation worse.
Correct.
All right, so part of trying to determine what's going on is you have a screening and an evaluation. Tell us a little bit about this.
Yeah, there's lots of different screeners for depression. We use something called the PHQ-9, and we deliver that to our patients at least once a year when they come through the practice. It asks 9 questions that can be scored from 0 to 3. 0 meaning you're never having symptoms, to 3 you're almost always having those symptoms. And we can go through those questions right now. The first one would be little interest in or pleasure in doing the things that you usually do enjoy. Feeling down, depressed, or hopeless. Trouble falling asleep, or the opposite, sleeping too much. Feeling tired and having very little energy. Poor appetite, or the opposite, overeating can be a symptom. Feeling bad about yourself, feeling that you're just a failure. Other symptoms, trouble concentrating, like reading the newspaper, you can't seem to stay focused on that. Moving either too fast or too slow can be an episode that we look for as well, too. And finally, the most serious thing is thoughts that you would be better off dead or you want to hurt yourself. And so, again, we total that score and decide then whether somebody maybe needs treatment.
Okay, so if you get a score of 7 or more, then
Yes.
that can be concerning.
It's very indicative that you are suffering from some level of depression, and so some therapy may be appropriate for you.
Okay, anything else as we wrap up here, bottom line for people that maybe took this survey and the results indicate that there might be a problem, what would you encourage people to do?
Don't suffer alone. Depression is a treatable illness. It's a biochemical process. We have good medications for it. We have counseling and therapy for it. And so seeking help. If you would seek help for other biochemical processes like diabetes or thyroid, seek help for your depression too.
Okay, thank you so much, Dr. Samuels. And always remember that suicide is a permanent solution to often what is a temporary problem. Dr. Steve Samuels with Franciscan Health, thank you for coming today.
Thank you.